And our last presenter for this session is Monica, so I'll turn it over.
Good morning, everyone. My name is Monica, and I'm a nursing student here at Piedmont. And today I'm going to present my symposium presentation, which is on the adverse child health and cognitive outcomes related to postpartum depression. So I developed a question to help guide me and help me get information from my articles and studies. And it is, are infants and children born to mothers with postpartum depression more susceptible to adverse health and cognitive outcomes compared to infants and children born to mothers without postpartum depression? And I have broken down my PICO question, which is P, which stands for population. It's infant and children. My intervention is prevention, detection, early intervention, postpartum screening, treatment, and child health and developmental assessments. Comparison is infant and children born to mothers without postpartum depression. And my outcome is infant and children born to mothers with postpartum depression are more susceptible to adverse health and cognitive outcomes. So before I go in depth with this presentation, I want to touch base. on the background. So does anybody here know what postpartum depression is or has heard of postpartum depression? Okay. So postpartum depression happens, this depression that happens after child birth, and it's a very dark time for a mother. Some of the signs and symptoms are irritability, insomnia, feeling unexplained sadness. And the one that I want to focus on is the inability or trouble to bond or connect with the baby or the infant. And then I also want to talk about the early years of the infant or child. They're very important. We know if we've had a baby or if you're around a baby that the family is always worried about if they're going to be breastfed, if they're going to have formula, which formula is the best, which pediatrician they're going to go to, because we want to take them to the best pediatrician. Because it's important for their health. But we never connect the mother's health with the baby's health, which is what I'm going to talk about today. So for my research presentation, I gathered 5 articles. The first one was association between prenatal and postnatal psychological distress and cognitive development. My second one was consequences of maternal postpartum depression, a systematic review of maternal and infant outcomes. My third one was postpartum depression effect on child health and development. My fourth one was effects of treating postnatal depression on mother-infant interaction and child development. And then my fifth one was prenatal and postpartum maternal psychological distress and infant development. And before I share those results with you, I just want y'all to think about what an infant or a child could experience through a mother's postpartum depression. Again, this is a very dark time, and mother is having trouble bonding and connecting with her child. So I gathered 3 things that I thought a child could experience. One was the lack of interaction, which is very important in the early days, early months and years. Lack of sensitivity from mother, and lack of warmth. Now, this all varies from person to person. Postpartum depression ranges from mild, moderate to severe. So every case is different. So what I did is I gathered all my articles and put all the results together. That way it wouldn't take me too long to go over all of them. But the results showed that there's presence of cognitive delay ranged widely from 7% in infants of non-depressed women to 25% in those of depressed women in the community sample. Infants of non-treated postpartum depression mother has statistically lower IQ scores than those of non-depressed mothers and treated mothers. Treating postnatally depressed women did benefit the mother-child relationship and improved cognitive development in children. So this means that there is a correlation between the health and adverse and cognitive delay on children with mothers who have postpartum depression. But if we treat it early, we can reverse these adverse outcomes. One study specifically reported cognitive delay to be 3 times greater in toddlers born to women with postpartum depression at 29% compared to those without postpartum depression at 9%. Depressed mothers were less likely to practice healthy habits with their infants compared to non-depressed mothers. Some were like placing their infants on their back to prevent SIDS or using car seats for car safety. Children whose mothers were depressed between 2 to 4 months had increased missed child appointments, inadequate immunization status, and a higher risk of visiting the ER. Children of mothers with postpartum depression had more colic, diarrheal problems, overall greater pain sensitivity, and increased risk of mortality compared to children of non-depressed women. And lastly, children with mothers suffering from postpartum depression, they had higher risk of chronic disease, acute disease, more daily medication intake, and less likely to be breastfed. And this could be because of that lack of bonding connection with the baby. Okay. So how is this relevant to nursing practice? Well, as nurses, we educate, we help prevent, we screen, we assess, we help physicians diagnose, and we help with the treatment and interventions. So this is something that we could help educate the mothers, partners, family members about what postpartum depression is, signs and symptoms, as well as what we know now, which is that it does have a correlation with the adverse health and cognitive outcomes in the infant and child. We can help screen with face-to-face interviews or questionnaires such as the Eldenberg questionnaire. And we can help assess the mother, her mood, behavior. We can also help assess the child. Are they meeting their milestones? Are they having failure to thrive? And we can treat and plan interventions such as medications, group therapy, and counseling. We can also start introducing postpartum classes as nurses or support groups. We can provide support as nurses. We can encourage our patients to speak up about their feelings, how they're feeling, and then also integrating postpartum screening education for nurses. Most importantly, postpartum nurses and pediatric nurses, but nurses overall. It is pivotal for nurses to educate patient, partner, and family about postpartum depression, the signs and symptoms, as well as the effects postpartum depression can have on the infant child health and cognitive development. By preventing and treating a mother's postpartum depression, we're mutually taking care of her child's health. And these are my references. And do y'all have any questions? Yes.
Do you think that someone like a mother who struggles with depression before becoming pregnant is more likely to have postpartum depression?
Yes. So as nurses, if we are taking care of a patient who is planning to get pregnant and has a history of depression, I think it's important to go ahead and start educating her about what postpartum is, depression is, the signs and symptoms, and also their partner and family, because sometimes when you have postpartum depression, you don't know you have it while you're going through it. So if someone else knows, okay, she's not being herself, maybe we need to seek help. So yes.
What are some of like the treatment options?
So there's medication, there's counseling, group therapy. Okay.
That was our last session or presenter for this first session. Presenters, please come up to this front table to get your t-shirt and your certificate. Our next session begins at 10:10. So you have a little bit of a break. If you're staying for the next session, please make sure you scan into the QR code for session 2. If you have not scanned in for the session 1, please do that in the back as well. Other than that, we have a few minutes in between our sessions.